The death toll is rising nonstop as Israel intensifies its strikes, pushing into central and southern Gaza. The Hamas-run health ministry says over 21,000 have been killed, and the vast majority of Gazans are displaced.
It's just destruction around us, as you see. The buildings are destroyed. This is not a war, it's a genocide. It's more than a war. We can't even describe it.
The war has left much of Gaza in ruins, destroying nearly 1 in 5 buildings. And there's no end in sight. Set on eliminating Hamas, Israel's military said it is expanding its ground offensive and released footage showing its elite troops in Gaza.
The fighting is taking place in a complex area. Therefore, the war will continue for many more months. And we will work with different methods so that we can hold on to our achievements for a long time.
On the other side, in Jerusalem, a former Israeli settler hopes a long-term plan will also include her return to Gaza. She was forced to leave the Strip nearly 2 decades ago when Israel withdrew all its security forces and settlements. There's a deep emotional tension because deep inside, we dream of returning there. This is our home. But do I know what will happen? The return of Israeli settlers to Gaza is not part of Israel's plan so far. But some here say it needs to be part of Israel's strategy to maintain long-term rule.
They're not talking about it yet in the Israeli government, but this is something that can happen, because there might be no choice. The IDF will have to rule in Gaza. In any case, you can't rule if you don't have settlements there.
It is still not clear who exactly would govern a post-war Gaza, or what Israel's plan is for lasting peace.
Let's take a step back and take a look at the humanitarian situation currently in Gaza. I'm very pleased to welcome Dr. Margaret Harris from the World Health Organization for more on this. It has now been more than 11 weeks since the fighting began in Gaza. Last Friday, the UN Security Council passed a resolution urging more humanitarian aid quickly delivered. Has it become easier to get that kind of humanitarian assistance to those who need it?
No, because there's ongoing war, airstrikes, damage to the roads. It's extremely dangerous to move around at all. We are sending missions to the north, to the centre, taking enormous risks. Our staff are telling us of the losses of their family members, and when we take our medical supplies to hospitals, our trucks are stopped, surrounded by starving people, just wanting to know if we've got food and opening the boxes to see if we've got food. It's becoming more and more difficult every day because the bombardment continues and the starvation continues and the illness increases.
Now, I want to put to you something that was brought up by the Israeli government today. A spokesperson today blamed the UN and Hamas for aid not reaching Gazans. He said aid simply isn't reaching the people who need it because Hamas is hijacking it and UNRWA covers up for it. What is your response to that?
We have not seen this. We send our missions, and as I said, it's not getting the aid across is difficult because of the complexities of the checks. It's a very slow process. But the real difficulty is distributing it in Gaza because this is a very dangerous place. There are bombardments all the time. If we truly, and if all sides are truly committed to providing genuine aid to the people of Gaza, there would be a ceasefire right now.
And give us a sense of the humanitarian situation on the ground. I know I've asked you this question many times before, but 11 weeks into fighting having started, can you tell us how things are looking in Gaza?
Worse and worse by the day, by the minute. The hospitals are doing what they can, but they are overwhelmed. They're the ones that are open. At the moment, we've been able to support up to 13 hospitals now to just keep going. A lot of them are not even able to accept new patients, but are trying to look after those they have. What they've also become is shelters, refugee shelters. You mentioned the hospital Al-Amal that had a bombardment nearby. It's got 14,000 people just sheltering there because they don't know where else to go. They've been displaced over and over again. And as I said, people are starving. They're dehydrated. They're living in filthy conditions, really, really filthy conditions. And we're seeing the diseases that are created by that. We're seeing a huge rise in diarrhea cases. We've reported more than 130,000 of those. We're seeing a huge rise in respiratory problems, bronchitis, coughs, colds, especially among the small children, with more than 150,000 cases of that. But also jaundice, which is probably hepatitis, meningitis, many severe diseases. And also we're seeing surgeons having to amputate limbs because there is nobody who can do the complex work to save those limbs. So basically, the people of Gaza are being bombed back into the Middle Ages.
Well, thank you for taking the time to speak with us on DW. That is Dr. Margaret Harris from the WHO.